Hello, my name is Claudia Molina. Today I will talk breeds morphology and the breeds category 1. First, breeds morphology refers to the anatomy of the breeds. The breed is composed of different types of tools that work towards to perform important functions. The main components are glandular tissue, fatty tissue, and the connective tissue. The glandular tissue is responsible for produce milk. Tissues is organized into lobe and lobulus. The lobulus produce milk, which trails toward small tubers catch drugs. The drugs carry the milk to the nipple. Another important component is fatty tissue. Fatty tissue which the breast, its seeds and chirp. The amount of fatty tissue can vary between individuals. The breast also contains connective tissue which supports the structure of the breast and helps maintain its shape. Medical imaging techniques are very important for evaluating breast morphology. The most common imaging method is mammography. Mammography allows doctors to observe the internal structures of the breast and detect possible abnormalities. Other imaging methods include ultrasonic and magnetic resonance imaging, which can provide additional information when necessary. Note I will explain the breast category. 1. The breast stands for breast imaging recording and data stream. It is classification system used by radiologists to direct the results of breast imagology studies. This breast category 1 means a negative result. This means what the breast is operates normal and superior figures are detected in the imaging study. In each category, there are warmisms, classification of their normalities, what should decide that reinforce the recommendations for the breast one is round setting according to where present and its factors. In conclusion, under breast morphology and the DRAS classification system is essential for the early detection and proper evaluation of DRAS disorder. Thank you.
Hello, my name is Jessica Cifuentes, and I'm going to explain the BRATS 2 and 3 classification and their associated pathologies. BRATS 2. These are benign findings with no risk of malignancy of cancer. Biopsy follow-up is not required, but an annual medical check-up is necessary. The pathologies associated with this declassification are simple cysts, which are fluid-filled sacs within the walls. calcified fibroadenomas, which are benign tumors that harden over time, intramammary lymph nodes. These are the body's natural defense located within the breast tissue. Fatty deposits or lipomas. Breast implants which are in good condition. Scars from previous surgeries that have not changed. BRATS 3. This refers to findings that are probably benign, where there is a low probability of cancer. Short-term follow-up 6 months. It's recommended to ensure there are no changes. The patient should have regular check-ups for monitoring. If the lesion remains the same for 2 years, it could be rewarded to BRATS 2. But if it grows, it is classified as BRAT 4, and biopsy is required. The pathologies associated with this classification are following: solid oval-shaped nodules, nude fibroadenomas or fibroadenomas without classification, complicated cysts, which are clusters of very small fluid-filled sacs, focal asymmetries, which are areas of breast tissue that appear slightly different but not constitute a clear mass.
BRATS 4 and BRATS 5. Gracias por su atención. BRATS 4. Suspicious lesion. BRATS 4 is used when the imaging study shows a suspicious lesion, but one that does not meet clear criteria for malignancy. It is subdivided to express the degree of suspicious. BRATS 4A, low suspicion of malignancy. BRATS 4B, intermediate suspicion. BRATS 4C, moderate to high suspicion of malignancy. Management in all BRATS 4 subtypes, a biopsy is recommended as it is not possible to confirm the nature of the lesion with imaging alone. BRATS 4 is assigned when a lesion has suspicious characteristics, but these are not entirely conclusive of malignancy. It is subdivided to stain the risk. BRATS 4A, low suspicion, 2 to 10%. BRATS 4B, intermediate suspicion, 10 to 50%. BRATS 4C, moderate to high suspicion, 50 to 95%. Case examples: 4A, a 35-year-old woman with an oval nodule partially circumscribed margins on ultrasound. It may appear benign, like a fibroadenoma, but it has slight irregularities. 4B, a patient with an irregular hypothyroid lesion without clear acoustic shadowing in the breast. It is not typical of cancer, but neither is benign. It requires confirmation. 4C, lesion with irregular microbial borders not fully speculated. High suspicion very close to malignancy. Management: biopsy in all cases, maybe core needle biopsy, ultrasound guided or stereotactic biopsy. BRATS 5. High suspicion of malignancy. BRATS 5 correspond to lesions with a high probability of being cancerous greater than 95%. The imaging characteristics typical of malignancy making the presumptive diagnosis very strong. Management: urgent biopsies, immediate management with timely referral for diagnosis confirmation and initiation of treatment. Key message: BRATS 4, variable suspicion, biopsy indicate. BRATS 5, very high suspicion, urgent biopsy and immediate management. BRATS 5 indicates a lesion with classic cancerous characteristics with a probability greater than 95%. Case example: Speculating mass or mammography, radiating borders, highly suggestive of carcinoma, cluster pleomorphic microcalcification, typical pattern of malignancy such as ductal carcinoma, irregular lesion with posterior acoustic shadowing on ultrasound, classic finding in breast cancer. Architectural distortion without a defined mass, highly suspicious for tumor infiltration. Management, urgent biopsy, immediately referral to a specialist, oncology or mastology, rapid initiation of staging and treatment.
Good evening, everyone. My name is Damaris Moreno, and we continue at Bira's Seats. By Repstein, now malignancy. Definition: a malignant breast lesion, a rare diagnostic prior to any serious treatment. Implication: confirms the diagnostic of the breast cancer and the and is used for contemplating evolution response to new new pageant therapy and monitoring disease progression characteristic and the relation with historical diagnostic and malignatures in the carcinoma ductal car- carcinoma in basilovular carnicom and carcinoma in situ. It might substitute radiology features used for planning surgery intertime mastectomy, lumpectomy, evaluating response to the new band therapy. Chismore therapy, radiology therapy, and monitor is cause of advanced breast cancer. Recommendation: in median oncological treatment close follow-up with the breast imaging tumors, marks, and multiple disciplinary evaluation. Importance: also, process therapy planning helps evaluate treatment efficacy and improves survivors and quality of life for parents. Example: in basic conductal carcinoma and in lobular carcinoma with confirming histological diagnostic or carcinoma in situ. Different from other BRAS categories, unlike categories 2 by um, 3 probably benign and 4 and 5 suspicious lesion recurring biopsy. BRAS already has confirmed a diagnostic of malignancy. Acute use of breast exams. Mammography. Mammography. Digital or analogy mammography. Function detects the relations microcalcification and change in breast to density. Depth screen mammography for earlier detection in the asymptomatic woman. And diagnostic mammography to evaluate signs of the subcision lesions. Ab- Advanced hints sensitive for detections breast cancer, especially in women over 15. Limitation: might have false positive, especially in detector breasts. Breast ultrasound Kimen ultrasound wide night frequency trials. Function. Evolution burns, nodules, situs, and population. Complementing. Mammography. Advergence. No invasive, no radiation, useful for differences for the solid lesions. On limitations, operator, detected the less sensitive, the mammography for detecting microcalcification. Birmingham Breast MRA